Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here for another one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. This is a chance for me to answer any of your questions live, so please feel free to put those into the chat. It's also a chance for me to answer any questions that you guys have submitted onto the videos. Please remember to check us out on Facebook, Instagram, and Twitter for additional content. Those will be linked into the description. Please also share the channel with your friends and family. And please like and subscribe to the channel. It really helps content creators out when you subscribe to our channels. And as a content creator, with enough subscribers, I was able to join the YouTube Health platform. So this is a part of YouTube where they are going ahead and verifying healthcare providers and making sure that they are legitimate providers providing good content to you guys. So you can feel rest assured that this is a trusted source. For those of you guys who stick around to the end, I'm going to let you know what next week's this week's video, which is coming out tomorrow, will be. And like I said, please feel free to put some of your questions into the chat. I'm going to go ahead and get started. For those of you who were so patient with me last week while we dealt with some family stuff, I have tons of questions this week because we have 2 weeks. So I'm going to get to some of those right away. So we're going to go ahead and we're going to get started. I like to start with bleeding a lot of the times. This is extremely common and we always get a lot of bleeding questions. And while sometimes they seem alike, they actually oftentimes have a lot of different information within them. So we had the first one, which said, I'm 8 weeks pregnant, but I'm still having my period. The next one said, I have had red discharge, which was seen in my first trimester at 12 weeks pregnancy. Is it complicated? Okay, so we're going to start with those two questions right there, because I think that's a good way to get us started on the bleeding topic in general. So bleeding during the first trimester is extremely common, okay? We see it for a variety of different reasons. So for starters, the first person said, I'm still getting my period. Is this kind of normal? You can actually continue to menstruate and have a normal menstrual cycle for the first couple months of your pregnancy. Now, this is not common, but it does happen, especially if you think about it during the first and second month of pregnancy. A lot of women don't even find out they're pregnant until they're 6 weeks along. And part of the reason for that is because they still get their first period, that period at 3 or 4 weeks pregnant. And that's just simply because your body's kicking into gear. It doesn't quite get the signal that you're pregnant yet. Doesn't mean there's anything wrong with the pregnancy. It just can kind of happen. Other women, if you've ever seen those shows, I had no idea I was pregnant, I had my period throughout. That's a real thing. Some people will continue to menstruate throughout their entire pregnancy. So that is one very real cause. Another cause can be spotting due to several different things. For starters, sex. The hormones for a healthy pregnancy, they thin out vaginal tissue. It gets drier and it can tear very easily. So you can find yourself bleeding after a couple of different activities such as sex, or if you are kind of wiping too hard. You can also have bleeding from different types of infections. So you want to make sure if you are having any bleeding, you get checked out. One of the things that you can also have is you can find that you might have bleeding from hemorrhoids. So hemorrhoids are like dilated blood vessels in the anus, and it's actually one of the things that can bleed. And some people think it's coming from the vagina, and it's actually coming from the anus. So these are just many, many things that can cause bleeding. So is it complicated? Sometimes it is. You need to make sure you're getting all bleeding checked out. It is so essential, because one of the things that they're going to do is they're going to do a couple tests. So let me go to the next couple questions. I'm expecting to be pregnant, but the thing is, I'm having brown discharge for more than 20 days, and the home pregnancy tests for HCG have been negative until now. I'm still having brown discharge. Will I get a positive pregnancy? Is it possible? Today I'm 6 weeks pregnant. I have been bleeding for almost a week. Before it was only brown and when I would go and wipe, but now I'm bleeding heavily. I already have a blood test and an ultrasound twice. And the doctor said we're not able to see anything properly as it may be too early. But my pregnancy hormone levels are increasing. Pregnancy hormone levels in the blood are increasing. What can I do about it? So now we kind of skirt into the whole, is it complicated? You don't know until you figure out the cause. And so what we need to do is you always need to contact your healthcare provider. I have a video on what to ask if you present to the hospital and you are bleeding, like what you're supposed to ask and what you're supposed to make sure is actually being checked. So we can try to link that into the description. But for starters, one of the things they're going to want to do is they're going to want to check your blood work to see if you're pregnant. So the first question said a home pregnancy test was negative. That home pregnancy test is a urine test, and it's testing for human chorionic gonadotropin, HCG levels in the urine. Now, in the urine, you only basically get a positive or a negative. And unfortunately, you can be having a miscarriage and still have HCG showing up for a little while as the hormone drops out of your system. So the way we determine by HCG levels whether your pregnancy is going well is we go ahead and we draw your blood as indicated in the second question. HCG levels should approximately double every 72 hours. So we want to make sure that we are checking that to see how things are going. And if we're seeing that the levels are rising, it's very possible that your pregnancy is going well. Now, a couple other things we do. Ultrasound, that's another big one. So the second question mentions an ultrasound ×2, and they can't really see anything well. That's common. So ultrasound technology is advancing so fast, but it is not perfect. And it is extremely hard to see a very early pregnancy at 4 or 5, 6 weeks. It is extremely hard. In fact, sometimes we can only see a sac. We cannot see the baby inside. We cannot see a heartbeat. And that doesn't mean these things aren't there. You will also find that some people will get an ultrasound early on, be told that they're having a single baby, and then 4 weeks down the line, 6 weeks down the line, they have another ultrasound, and lo and behold, they're having twins. So like you can't always see everything that you're expecting to see. So it's very important that you get checked out so that we can try to determine what is going on. Now, if your HCG levels are rising, even if you can't see anything on an ultrasound, that doesn't mean that there's not something there. And even if you're heavily bleeding, you still might have a successful, healthy pregnancy, because the cause could also be something like a subchorionic hemorrhage, which we have a video on that we can link into the description, and also, for example, a placenta issue. Okay, so it's very important ultimately that you guys get checked out if you're having any bleeding. For those of you who are joining me, please feel free to put some of your questions into the chat. So now I'm going to answer a question that we got, which I rarely get, which is about ultrasound, because I just talked about ultrasound. So is the ultrasound due date correct? Mine says April 10th. So I really want to know. So, you know, ultrasounds are improving a lot, but unfortunately, you can't always get everything that you want or even an accurate measurement. I can tell you in my career that I have seen women come in for inductions because they were told they were going to have a 10-pound baby on ultrasound. We deliver that baby and the baby's 6 pounds. It happens. Women, unfortunately, have had C-sections because they were told the baby was too big. We've just seen all sorts of stuff. I was in the room for at least one delivery that was quite eventful when everybody was expecting a girl. Oh, there's my cat to join us. And instead, what we had was a baby boy. So it's always one of those things that you never know for sure what you're seeing, okay? It's pretty accurate technology, but it's not perfect. So is your ultrasound due date correct? Hard to say. It's as best as we can guess, but I can tell you that I have many patients who they're between 2 different due dates, and it comes down to the size of the baby. You know, if you don't know your dates, and everybody thinks you're 32 weeks because an early ultrasound gauges you at 32 weeks, but the baby's bones, the baby's size, the baby's head is measuring at 36 weeks, and you're not sure about your dates, that baby might be 36 weeks, especially if they can't figure out why else the baby would be big, like gestational diabetes. So I wish I could give you a perfect answer. There is no perfect answer. It is probably accurate, but you can't say that it's perfect. Continuing with bleeding, I have 2 second trimester bleeding questions. So I'm 18 weeks pregnant now and I'm experiencing brown discharge. Is this safe? So I have a video on the colors of bleeding, okay? And what you guys want to know is that there are different colors and they indicate different things. So brown is old blood. This means that there was blood at one point in time and that blood is like resolving, that bleeding is resolving. And so what you see left is brown discharge. So brown can be a sign that everything is moving in the right direction. Unless brown is the first thing you see and you haven't been checked out, okay? If you guys have a brown discharge and you've never spoken to your healthcare provider about this, you need to go and have a peek at what's going on. But brown, generally speaking, is okay. However, we had another question which said, I'm 16 weeks pregnant and I have a little reddish, pinkish, brownish spotting with raw egg white cervical mucus discharge. I don't bleed a lot or get my underwear stained just when I wipe. Is it concerning? This is my rainbow baby and I am very anxious. Okay, so pinkish reddish is a sign of more active bleeding. This is where we start to get concerned. But the raw egg white cervical mucus, that's the part that I'm honing in on. Okay, mucus is normal. Okay, we have vaginal mucus, but you shouldn't see a lot of mucus, especially when you're talking about those colors during your pregnancy. That is not something that we want to see. So that can often be a sign of an infection. So infection is one of the #1 causes of preterm labor, miscarriage, stillbirth, etc. And this is all types of infection, including systemic infection, like you get strep throat and you become septic from it, or if you had a urinary tract infection. I mean, infection is a big deal for a pregnant woman. And a lot of people don't quite understand why, but here's the deal. You're immunocompromised when you're pregnant. Okay, you're like a cancer patient, kind of. So your immune system is very hyper alert at all times. We're constantly being bombarded with viruses and every other thing, okay? And human beings are well adapted to fight those off. Plus, we have stuff like vaccines and antibiotics and all that other good stuff. But when you're pregnant, you have a foreign body in your system. So if you guys get a splinter, I don't know if anybody's gotten a splinter where you get that like little piece of wood inside your finger. If you leave it there, it gets puffy and swollen and like red and it hurts. That's because your immune system is fighting that foreign body. It goes straight there and it's trying to get that foreign body out. And it is fighting it with every resource that it has. Your pregnancy, your baby is a foreign body, okay? Your immune system does not recognize that foreign body. Your baby does not have identical DNA to you. Therefore, it does not match you. And baby's blood does circulate into your system through the placenta exchange, right? So your body is like, whoa, 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 what is this? So if our immune system didn't calm down, basically mute or not work as well, we would end up attacking our own babies with our antibodies, and that could lead to different types of things like miscarriage. Now, as a result, that means that you're more prone to infection. And because of that, you need to be very careful. When you have any kind of discharge, like what is described in this question, you want to go get checked out and you want them to swab that discharge. So what we do is we do a pelvic exam and we take a sterile Q-tip swab and we gather some of that and we send it off to a lab, right? And so that lab goes ahead and it checks that mucus, and it's looking to see, what is it? Is it normal? Is it semen? Is it a premature rupture of membranes? That means your water is breaking early. Is it yeast, fungus, virus, bacteria? So all of those things can go ahead and help us identify what is going on. And if you have certain types of infection, there are certain types of medications we can give you to help treat the infection and help prevent any complications like miscarriage. So in this case, this person, this viewer should definitely get this checked out so that they can try to prevent anything that might be going on before it gets too far. Hi, Obapa. I'm 25 weeks and I'm experiencing leg cramps at night only when sleeping. I put a pillow in between my legs, but it's not working. It's affecting sleeping. What are your recommendations? My recommendation is a banana. So I can tell you that the number one prescription that I write in my practice is Gatorade, basically electrolytes. We all seem in our busy lives to be very electrolyte deficient, and that's extremely common for women who are pregnant. And a big thing for leg cramps is electrolytes. So the two electrolytes that come into mind are potassium and magnesium. So I actually think I would recommend both. So let's start with potassium. Potassium is a vitamin that if you're depleted on it, if you get too low, you'll get something, at least where I'm at, we call them Charlie horses. Basically, all of a sudden in the middle of the night, you wake up with a sharp cramping. I mean, it's like 10. It wakes you up and you sit straight up because you're in agony. And the best thing to do is like kind of stretch that muscle out, right? You stretch the muscle out to try to get it to calm down. You rub a little bit. It's very painful. It's just horrible. Those are usually caused by a shortage of potassium. Now, before you guys run out and try to start taking a whole bunch of potassium, you cannot take potassium tablets. Do not take potassium tablets. There is potassium inside your prenatal vitamin. That is safe. There might be some potassium, for example, in a Gatorade, something like that. That is safe. You should not be taking potassium tablets on its own unless you're doing it under the guidance of a healthcare provider. Potassium, if you overdose with it, can cause serious cardiac heart arrhythmias, okay? So the reason why I say a banana is the idea is a banana is very high in potassium. And a banana is a great way for you to get potassium safely. Okay, you could insert another type of food there if you wanted to, but bananas are pretty easy to stick at your bedside and take in the middle of the night. A sugar-free Gatorade can also do the same thing. The idea is that it's a quick little bit to help get you through. You could also eat a banana every day unless you have gestational diabetes. Bananas are very high in sugar and should not be used by somebody who has gestational diabetes. Now, secondary to that, magnesium. So if your cramps are more of like an achy-ish type of cramp, they last for a lot longer, very, very like tired legs, stuff like that, magnesium is probably the one you want. Magnesium is a smooth muscle relaxant. So it relaxes all of these muscles, okay? And I show my arm, but legs too, right? All your body's muscles. So it's very, very, very good for helping with cramps. Now, secondary to that, magnesium is also used for sleep and for anxiety. It's a very homeopathic treatment for both. I usually recommend magnesium glycinate. Magnesium citrate can sometimes upset your stomach. We use magnesium in the hospital to help prevent preterm labor. Now, before you guys start running out and just grabbing a whole bunch of magnesium off the shelves, you need to talk with your healthcare provider. They ultimately know your health profile. They may decide that you actually would benefit from a little bit of mag citrate and glycinate because maybe you have some constipation and you have this. So you want to make sure that you're asking for both, like asking them just to make sure. And then you want to just make sure there's nothing else in your health profile that would prohibit you from taking magnesium, although I don't think that would be the case. So, and then finally, Gatorade. Sugar-free Gatorade, guys, I would recommend you drink one a day unless there's something in your health history. Really, electrolytes once a day are probably good for everybody. Just don't overdo it. And definitely sugar-free. You guys don't need the sugar from Gatorade. Hi, Courtney. I don't think she asked a question here. So maybe take a look and see about that. I'm going to answer another question while you're looking at that. I kind of just talked about discharge, right? So one of the things I want to let you know is I had a question on my vaginal discharge video. And so what that question was I'm 4 months pregnant. I have white discharge like water. Is that normal? Anything that's colored and like water is especially concerning. Usually that's one of two things. That is either a true on infection or that is your water has broken. So either one of those things is a absolute, you must contact your healthcare provider. Okay. Now we talked about like, okay, is this potentially like an infection? So what usually goes along with that next is medications. So I have a video on antibiotic use during pregnancy. It is very common for you to get antibiotics for a variety of reasons, including urinary tract infections. So one of the questions I got was, I'm 10 weeks pregnant. I went to the emergency room because of a severe cough. So they prescribed me amoxicillin clavinate 875, 125. I'm so scared to take it. So that's an antibiotic that's also known as Augmentin. Augmentin is used to treat bacterial infections. So let's start with antibiotics 101. Antibiotics must be taken as directed. If you start them, you need to finish them. Antibiotics are amazing because we start to feel better within like 24 hours, which is like super awesome. And then a whole bunch of people will be like, oh my God, I'm pregnant. I don't want to take anymore. And they stop. And that is terrible for you because that's how we get antibiotic resistance. Antibiotic resistance is simply this. So you get an infection. It's a whole bunch of germs. You start taking the antibiotic and it starts killing off lines of germs. But these guys in the back, they're paying attention to how this works, right? So they're sitting there and they start building a wall of defense because they're in the back. So they got time. So they see what you're doing. They're building their wall. They're building their wall, right? And then you stop. And so now there's nothing like coming after them trying to get rid of them. So they finish their wall and they call in reinforcements. Now, when they call in those reinforcements, you start to feel worse. And that's usually like 24 to 48 hours after you stop the antibiotic, but you never took it the right way. Okay, so now you don't feel good, right? So you don't feel good. And so you're like, oh, I need to like take this medication again. Like, I can't believe that I didn't finish it. So you start, right? So you start the medication again. But guess what? Now there's this big giant wall. You can't get through that wall. And now, even though you finish the medication, it doesn't work and we have to give you something else. That's antibiotic resistance. So once you start an antibiotic, unless your healthcare provider tells you to switch it, you should take it all as directed. Augmentin is one of many antibiotics that's safe for use during pregnancy. So yes, taking Augmentin is safe to treat a bacterial infection. So one of the things I will tell you is if it's a virus, right? So sometimes coughs are like part of a cold, and the cold is just a standard viral cold. An antibiotic is not going to help with that. So if you're a little nervous, ask your doctor, do you see a sign of infection? Like, are you sure this is a bacteria or is this just a virus? Can I wait it out? Because if it's just a virus, that antibiotic isn't going to do anything. And then you're going to be taking something that you don't need. When it comes to Augmentin, one of the ways we determine safety of medications, there are no studies. You cannot study pregnant women or breastfeeding women with medication. It's not ethical. So what we have to do is we have to look at a whole bunch of different factors, the safety profile of the med, the half-life, the molecule size, the fat solubility, animal studies, all different types of things. So for Augmentin specifically, they have used it in animal studies at 5 times the human dose, and they haven't seen any adverse effects, which is why we presume it to be safe for use during pregnancy. And it's been used with many, many women. It's often used actually when your water has broken, okay? So for those of you who are joining me, hi, I'm Dr. Samantha, the maternity mentor. Please feel free to put your questions into the chat. I am answering questions right now that have come in on some of the videos this week and last week. So my next question that I'm going to answer, I think I'm going to delve into baby aspirin. So I love the baby aspirin topic. It seems to be very popular. I got a whole bunch of baby aspirin questions and comments this week. So, should someone with a BMI of 34 be taking baby aspirin? Another question was, what if I check for only one of the moderate risk factors? It's my first pregnancy and I'm 34 years old. Should I take aspirin? Another one said, if I don't have a previous miscarriage history, should I still take aspirin? The midwife did not recommend it since it's my third pregnancy. And finally, I've had 4 miscarriages, 3 chemical and 1 clinical miscarriage. Now I'm pregnant again, and it's my 5th week taking progesterone twice a day. Would you recommend me take baby aspirin? In addition to this, I have Hashimoto's disease, as the doctors here don't take things seriously, and I am suffering a lot. So these 4 questions kind of give us the crux of the baby aspirin type of deal. So baby aspirin is used in the treatment prevention of preeclampsia. Preeclampsia is severe hypertension that can occur during pregnancy, okay? It can be life-threatening for mom, and therefore it can cause life-threatening complications for baby. When we have preeclampsia, we are usually using the medication between 12 and 16 weeks of pregnancy. Usually 12 is our ideal time to start. So the first thing you guys want to understand is that you're not starting it when you're like 4 weeks pregnant. That's not when we do it. We do it around 12 weeks of pregnancy. Okay. Aspirin, it thins your blood out, so it can cause bleeding. That's actually one of the risk factors of taking aspirin. I get question after question after question about bleeding. One of the reasons why they don't just jump out the gate for a lot of women with aspirin is because it can cause bleeding, and that could be an issue. Now, a lot of people here mentioned a miscarriage. Baby aspirin at one point in time was used because it was theorized that it might help with people who had repeated miscarriage. The idea behind it was that maybe miscarriages were being caused by a clotting issue. So that maybe women had some kind of weird clotting type of disease or situation. And so when they were early in pregnancy, the babies, their placenta, so the placenta is like this organ and it attaches to the uterine wall. This uterus, it attaches to the uterine wall. These are a whole bunch of blood vessels. These are a whole bunch of blood vessels. These blood vessels combined, right? And then there's a flow back and forth from the baby to your body, etc. Well, if this ends up clotting off because you develop blood clots that close off the circulation, the placenta would die, and therefore a miscarriage could happen. So the idea was if you thin out the blood, that couldn't happen here. That's never really fleshed out in research to be shown as something that's true. Now, you may know people who take aspirin to prevent miscarriage. They may be doing that because they have some kind of identified clotting risk, okay? That is something that could happen. But it's very important for you to understand that that is not a true use of aspirin. Now, there are so many risk factors for preeclampsia that a lot of people end up needing to take it. So for starters, one of these questions said, I've had 4 miscarriages, I'm pregnant again, and I'm in my 5th week taking progesterone twice a day. Progesterone is a hormone that we oftentimes use to try to keep somebody pregnant who's had multiple miscarriages. Do you recommend baby aspirin? I have Hashimoto's disease. So a high risk factor for preeclampsia, amongst others, is autoimmune disease, and Hashimoto's is a form of autoimmune disease. So yes, this person should probably be taking baby aspirin, except not until you're 12 weeks pregnant, which is why your healthcare provider may not have even mentioned it. So you want to make sure that you're actively speaking with your provider, because possibly they haven't mentioned it yet because it's just not time. Okay. Now, one of them said that she's 34 years old and it's her first pregnancy. She only checks off one of the moderate risk factors, right? So first pregnancy, but do you have a family history of preeclampsia? And I would tell you, maybe even talking to them, if you have high blood pressure, do you have your body mass is over 35? There's other things to look at. And if you start to creep up with your blood pressure, then you may want to be talking to them about whether you should go ahead and do it anyway. So that's a conversation to be had. It's not just an automatic no, in my opinion, but there are risks. Again, bleeding. Bleeding is the risk that we are worried about. We're trying to counteract that. And then the BMI of 34. Oh my gosh. That one, let me tell you something. It's in the moderate risk category, which means you need 2 of those in order to really be meeting criteria. But BMI of 34, how close are you to 35? And at that point in time, you're at higher risk for stuff like high blood pressure and diabetes anyway. So should you be having the conversation about whether maybe you should just start it anyway? Okay. So I think this is a really good example, but I do want to make it very clear, despite what you guys may have heard, it is no longer recommended by ACOG, the American College of Obstetrics and Gynecology, for use as part of a miscarriage prophylaxis. The research doesn't support that at this time. Okay. For those of you who are joining us, welcome. I'm Dr. Samantha, the maternity mentor. I am going to start answering some of these questions that I have in the chat. Please feel free to put any questions into the chat. Hi, Sumi. I've been having sudden constipation and cramping today. Should I be worried? Same time all this is happening, my baby is very active. I thought I had preeclampsia. I had all the signs of it, but my doctor says I don't have it. Okay. First of all, if you have all the signs of preeclampsia and your doctors say that you don't have it, I would be monitoring your blood pressure at home just to make sure. Once a day, that's it. Do not ignore any of the signs. If you think you have signs, again, just keep going and checking. I'm not sure why they would have ruled that out. Depending on how far along you are, constipation and cramping is something that could be a sign of early labor. But constipation is a little weird because sudden constipation kind of concerns me about why did everything stop? Is the baby kind of in the way? Just so you guys know, changes in your bowel habits, especially at the very end of your pregnancy, can be a sign that you're going into labor. Okay. However, if you're having a lot of lower abdominal pain, you want to make sure you get that checked out. And you want to make sure it's not something like your appendix or something like that. The other thing is, guys, if you're having constipation, you need to call your healthcare provider to talk to them about it. You want to ask if you can use stool softener. So something like Colic. Colic is a stool softener, and it's not a laxative. It doesn't make you go to the bathroom like all that. It just helps to bring water into the colon so the stool is soft. Okay, so it helps make it easier for you to go to the bathroom. That can help with constipation. You can also ask about using magnesium and maybe some prune juice or something like that. Okay. You don't want to push too hard if you are having constipation. You can actually cause a lot of serious damage, including hemorrhoids and a prolapsed rectum. And that's not good, and that requires surgery. So make sure you're asking your healthcare provider, and then drink lots of fluids. Make sure you're walking, lots of fiber. Okay. All right. How often should a baby kick in the womb in a day? I'm 23 weeks and I can't really monitor the baby's kicks. Okay. So this is a great question. At this age, 23 weeks, it is very often hard for a mom to feel the baby's kicks. So it's really hard for you to get like an idea. As the baby gets bigger, the baby moves several times an hour. The babies kind of get this like rhythm, and we kind of go off of that rhythm. If you were to start to feel the baby slow down later on in your pregnancy, what we would do is we'd have you do a kick count. That's where you like actually formally sit down for 20 minutes. You mark down the counts. We're looking for about 6 in an hour or so. So we have you do that, right? And if the baby's really not moving a lot, we have you drink some orange juice or something and try again. But now there's another reason. So at 23 weeks, right? Your baby's actually pretty small. I've helped take care of 23-week babies that have been born that early. They're tiny. They're like this big, okay? So this is a very small baby inside a potentially big belly. If you have a lot of amniotic fluid, so if that baby's kind of really small peanut and a lot of fluid, that already is going to interfere with how well you can feel the baby, because the baby's basically in a big giant balloon, okay? Next, it depends on your placental position. So here's your uterus, right? Most of the time, our placenta goes on to the side, okay? But there is positioning that's anterior, that's front towards your belly button, and posterior, that's back towards your spine. If you have an anterior placenta, like up by your belly button, this is the type of placenta that makes everything like 1,000 times harder. Not from a health standpoint, but the placenta's right here, which means ultrasounds, you got to kind of try to curve around them to look at the baby. Dopplers, that's when you go into the doctor's office and they're trying to hear the baby's heart rate, and you're the moms that they're like looking and looking and looking and pulling up on your belly because they got to get around that placenta. And then finally, kicking. If you got a big, soft, squishy placenta pillow right in the front, and that baby's going to spend all its time kicking, you may not feel a lot of it. So just understand, depending on your placental position, that may actually affect it as well. Can one have a successful pregnancy with a severely weak cervix with a cervical stitch? Yes, you can. For those of you guys who don't know, a cervical stitch is called a cerclage. So you got your uterus and your cervix, okay? And a cervix, it actually kind of feels like this, just so you guys know, this is kind of what it feels like. So long, thick, and closed, okay? And your two fingers together actually very much represent a cervix, because a cervix has to dilate for the baby's head to come down, right? So closed, it can't obviously be like completely closed. It doesn't tear open. So instead, this little tiny slit right here, this is actually where your mucus plug sits. So the mucus plug is simply a line of mucus right here, okay, that blocks this little tiny microscopic opening. And this helps to prevent any bacteria coming up into the uterus. Now, when it's time for you to have the baby, what happens is, we're doing this in reverse now. Here's your cervix. You've got contractions, right? So the contraction's job is to kind of slowly pull. And as it's pulling, it's dilating. You see that, right? It's dilating. And then the other thing it does is it effaces. So if you guys hear that term, that's the thinning of the cervix. So dilation, 0 to 10 centimeters, effacement, 0 to 100%. So this is 0%. And what happens is the effacement happens and you thin out and then it goes up. So this is like 100% effacement. It's super thin, okay? And that's all your contractions are doing, is this, okay? And so what a cerclage is, or a cervical stitch, is that we have this and it starts to open early. And so what we go in is we literally go in with like a needle and surgical thread and we sew this shut, okay? And the idea is to hopefully prevent it from opening prematurely. If we keep the cervix closed, the baby doesn't deliver. For those of you guys who don't realize, we hear about 10 centimeters for delivery. But if you are 23 weeks pregnant, remember I just told you guys, that's like a little teeny tiny peanut. Okay, so if this is that little teeny tiny baby's head, and it's probably even smaller than that, right? Like something like that. This head can come through a cervix that's only 5 centimeters dilated. okay? A full-term baby needs a 10-centimeter dilated. So what can happen is if you get dilated enough, you will deliver early simply because the opening is big enough. And that's why we do that. Have I seen successful pregnancies? Yes, I have. I absolutely have. In fact, I've seen women come in where we didn't get them in enough time to cut the stitch before they were in active labor. So I've absolutely seen it. Okay, I think my constipation started because of something I ate. I was using the ball and I feel the baby kicking so much. I have an anterior placenta, but oh, this baby kicks. Yep. So it sounds like you're pretty far along, and it very likely could have been something that you ate, for sure. Okay, so we had a couple baby questions. So the first one was, I am pregnant while breastfeeding my 2-year-old daughter. Is it safe to nurse? So for those of you who aren't aware, I have been a lactation consultant for over 12 years, totally pro formula. Anybody who's doing formula, spot on. If you're using a pacifier, spot on. I think those are the best things ever. And if you're breastfeeding, awesome. So some people want to breastfeed their toddler and their baby. That is considered safe. It is done all over the world. There's no reason why you can't do that. However, you do want to double check because occasionally we have a pregnancy that's high risk and we wouldn't want to encourage that. And our example would be a severely weakened cervix. So breastfeeding, one of the hormones for breastfeeding is the milk ejection hormone, oxytocin, aka Pitocin. Pitocin is the synthetic version. We hear about it a lot. This is the medication we use to help with labor inductions. It basically causes you to contract. Remember, our contractions are pulling at this cervix. That's the point of them. Just so you guys know, if you're having sex and you have an orgasm and you start to feel contractions, that's because the same hormone that causes you to have an orgasm is oxytocin. So you can feel some of those uterine contractions at the same time, right? So that's what oxytocin is. Sometimes for somebody who has certain risk factors, we don't want you to breastfeed during pregnancy because that same hormone can cause you to have uterine contractions and uterine irritability. So it's definitely a conversation that you have to have. Now, I think it also depends on how old the child is. At this point in time, a 2-year-old is nursing not for nutrition, but for comfort, for closeness. So this might be a breastfeeding relationship that we could potentially pause if there's a lot of risk factors. But if you were talking about a 9-month-old who can't really eat food yet, that's a very different picture as to what risk benefits look like. So you always want to make sure you're double checking. The other thing you need to know is that you can be producing a full milk supply. And when you are pregnant, you could be breastfeeding just fine. And in the middle of your pregnancy, your milk may dry up and go to colostrum. Colostrum, remember, is that first milk for your newborn. It's very small and it's very nutrient rich. This is extremely common and it's normal. So some women will not maintain a milk supply even if they change nothing except getting pregnant. So you want to make sure that if you're breastfeeding, say, a 9-month-old, that you're double checking that they're getting enough. Make sure they aren't losing weight, they're peeing and pooping fine, et cetera, et cetera. But again, with a 2-year-old, this becomes a risk versus benefits. But generally speaking, it is considered safe and there is no reason that you couldn't continue that. So I have a question here. I'm 41 and I would like to know what my % chance to get pregnant is. Unfortunately, I cannot answer that. However, I can give you some information as to what to look for, ask for to figure out where you're at health-wise. So in my career, I have taken care of as young as 12 years old pregnant and as old as 52. So I have seen the full gamut. Now, if you are trying to get pregnant at 41, it is it is harder, okay? So you want to make sure that your health is as good as it can be. So you want to make sure you're eating plenty of, you're getting plenty of omega-3s. that you're getting plenty of DHA, that you're taking a prenatal vitamin. You want to be screened for electrolyte deficiencies, full thyroid, anemia, vitamin deficiencies. You want to make sure you don't have the MTHFR genetic mutation. For those of you guys who don't know, MTHFR is a genetic mutation that affects your ability to process folic acid. Folic acid is extremely helpful, extremely important for a healthy pregnancy. You want to make sure that you are in the ideal health. So try to lose weight, make sure you're exercising, reduce your stress. I wish I could say that there was some magic way to say if your chances are good or not. I will tell you that a lot more women are having babies after 40, and they really are having a good go at it. But you definitely also want to get in with a reproductive endocrinologist. So endocrinologists are doctors that are solely responsible for hormones. Okay. So these doctors also oftentimes take care of diabetics because insulin is actually a hormone-based system. Reproductive endocrinologists are doctors that actually specialize in the hormones that help you get pregnant and are helping you be fertile. So that's actually what you want to be looking into, Nancy. I'm in South Florida. There's a huge OBGYN group in our area, and they have multiple reproductive endocrinologists on staff because that's how important it is. And these guys are also really good because then later on in your pregnancy, if you were to develop like diabetes or something, they can also help with that. So that's another place to go. I'm 38 weeks and 4 days pregnant. This is my third baby. Should I consider inducing? Not unless there's a reason to induce. I don't think inducing just to induce is a great idea for anybody, okay? So we induce for a lot of good reasons. Just like a good reason might be a baby that we suspect was going to be large, or a mom that's having borderline blood pressure issues. So we're not sure where it's going. We don't want it to get to preeclampsia. So we want to get stuff done. But when you're having an induction, okay, your cervix is like this. It's long, thick, and closed, okay? Generally speaking, inductions don't happen when your body's truly ready to go. And so the reason why I hesitate with inductions is if your induction is done right, then yeah, sure. I mean, as soon as you hit 39 weeks, because 38 weeks and 38 weeks and 6 days is still a preterm baby. But you hit 39 weeks, absolutely, let's go for it. But the thing is, what is a right induction? So in my opinion, a right induction is an induction where you're allowed to go for up to 4 days minimum, as long as you and the baby are doing well. So I have a video actually on Cervidil. That's one of the induction methods that can be used. Is one of my favorite induction methods. Basically, Cervidil is a medication that takes this long, thick, and closed cervix, and we stick it up next to it. And the idea is to make your cervix go from this consistency to jelly, like a very soft thing. Because if we have your cervix all nice and soft and squishy, and we give you a little bit of Pitocin, then you'll thin out, you'll efface very quickly, and then it can be easy. But unless there's a really good driving reason to do it, I wouldn't consider it until you're 40 weeks, okay? But you guys definitely don't want to go past 41 weeks. That's where you go on the reverse end, and there can be a lot of complications as well. What are the chances of not being able to breastfeed? What causes them if there's any reason? The biggest reason why I could imagine that you wouldn't be able to breastfeed is if you don't have enough breast milk. That can happen. So breastfeeding is not as natural or easy as all the books make it seem. Okay, I'm totally pro breastfeeding, guys. I really am. But almost 100% of people, it hurts. So all that stuff that says breastfeeding shouldn't hurt, I'm just going to give you the heads up. It hurts. It hurts for probably a week, okay? You don't have somebody sucking on your nipples 24 hours a day, 7 days a week right now. And so it hurts. And babies, just so you know, breastfeeding is natural. Babies don't know how to do it. They have an instinct for it, but they need to learn how to do it, just like you need to learn how to do it. And you can have 7 kids and all 7 breastfeeding experiences will be different, okay? Some people are able to just pop babies on boobs and go, and others can't. And every single experience is unique. And then there's all sorts of other factors. What type of delivery did you have? Do you have any other risk factors? Moms with PCOS, for example, which is polycystic ovarian syndrome, some of those moms make gallons and gallons and gallons of milk, and others make nothing. Thyroid conditions can interfere. And then let's just talk about lack of sleep. You guys can be exhausted. And I'm not trying to discourage you from breastfeeding. I think it's amazing. And I think you can do it. I absolutely think you can do it. I also think setting a realistic expectation helps people be way more successful. Okay? When it hurts, it doesn't mean that you're a failure. It just means that it hurts. Now, if it hurts after a week, no, please get it checked out. Your baby's probably tongue-tied. But in the beginning, if you have a couple of days of really sore nipples, please, that's okay. You're not doing anything wrong. It's just you and the baby learning, and it will get better. So, what are the chances? It's way complicated. Hard to say. I heard a membrane sweep is better than inducing. Is that true? Membrane sweeps sometimes work and they sometimes don't. So for you, those of you guys who don't know, basically you have your uterus, your balloon of an amniotic sac is sitting in there, and the membranes kind of sit against the wall of the uterus. So when if you're dilated like 1 or 2 centimeters, your provider can go in on a pelvic exam. They usually do this in the office, not in the hospital. And what they'll do is they'll take their fingers with a sterile glove and they sweep underneath to kind of separate the sac from the wall. That's a membrane sweep. When they do that, it releases prostaglandins. Prostaglandins are a type of hormone that helps to ripen the cervix, okay? So when we mean ripen the cervix, we mean make that cervix all nice and squishy, like I was just talking to you guys about. So that helps you get into a better chance of having like a vaginal delivery. When you do that, it can also induce contractions. So it could get things started, but it might not help things move along. Just depends. It really just depends. Some people, that's all they need. Some people, they have this and it doesn't even work. For those of you guys who have never heard of a membrane sweep or something like that, again, it's sweeping, it can be painful. I think that some providers don't really explain that. They'll tell you, oh, it's going to be uncomfortable and going up. They have to stick their fingers through your cervix. Okay. So remember, this is a closed cervix. If it's like 1 centimeter, you're talking about just a little tiny gap and they're shoving fingers up there. Okay. It's okay. It's fine. I had one. It's okay, but it's not comfortable. And then they're taking their fingers and separating a balloon that's kind of gotten stuck to the side of the wall. So that hurts. I really don't think providers do a very good job of saying stuff like that hurts. Okay. So I feel like a lot of people can handle a lot of things if they know. And even the person who feels like they can't handle pain, if they know, if I say to them, this is going to hurt, but it might help, then they can make a decision and they can handle it. But when you're not expecting something to hurt and your healthcare provider does that, it can break trust. It can make you feel very violated, a lot of different things. I've seen women who've had trauma from this. So just to be very honest, guys, sometimes it helps, sometimes it doesn't, but it is not a comfortable procedure. I have another question. My sister had a DNC for an incomplete miscarriage due to abnormalities from chromosomes. Can she get pregnant and have this happen again? What are some of the things to consider? So, yes, if she had chromosomal abnormalities, that means, for anybody who's wondering, the genes at the genetic level, the baby had some kind of abnormalities that were not consistent with life. Yes, it could happen again. So what needs to happen for somebody like this is it would be best for her to have genetic counseling. So you can actually go to specialists, usually they're maternal fetal medicine specialists, who will go ahead and they will draw your blood. They'll usually draw your partner's blood, and they will send them off to see if you guys hold any, like if you're carriers for any types of genetic diseases, and then they can tell you your risks. So if two parents were to have sickle cell trait, okay, their child would have a 25% chance of having sickle cell disease. And that's what they do. They test both partners and then kind of give you a gauge. Now, genetic abnormalities, unfortunately, can just happen spontaneously. This is something we do see, and sometimes you can't prevent it. But definitely, if you have identified something like that in the past with a miscarriage, you want to seek genetic counseling. I had a question on dental work. Sorry. I'm 7 weeks pregnant and I have 4 teeth infections that they are saying must be removed to get rid of the infection. I have periodontal disease and 2 wisdom teeth that are decaying and falling apart, along with severe dental anxiety that causes me anxiety attacks. I've only ever been able to get dental work done while fully sedated. I'm not sure what to do, as the anxiety and the dental work and pain seem majorly unhealthy for the baby as well. Is sedation completely not allowed during pregnancy? So I have a whole video on dental work. Just so you all know, dental work is like hugely important for everybody's health. Okay. I don't know if you guys have ever heard of somebody saying, oh, I need to take antibiotics before I go to the dentist. The reason for that is that your teeth, your gums are directly kind of connected to your heart. And so a lot of people with certain heart conditions, they were getting like heart infections and dying. Now, this is like 30, 40, 50 years ago that they started to identify this, right? So then what happened was we started giving antibiotic prophylaxis. That means you take it to prevent the infection, and it really helped. So as a result, we've started to realize how important dental health is for your entire body. Flash forward to pregnancy. Remember what I said, guys. Infection is one of the number 1 causes of preterm birth, miscarriage, stillbirth, and oh my gosh, I forgot the last one. Oh, miscarriage. Sorry, I apologize. So as a result, we want you guys to get good dental care. It's extremely important. Now, you don't want to do optional procedures. So let's talk wisdom teeth. If your wisdom teeth are in, you were planning on getting them done. Oh, I'm pregnant. Your wisdom teeth aren't bothering you. Just wait until you're done being pregnant. But in this case, if you've got decaying teeth that are like potentially going to cause an infection, you need to get it taken care of. Now, what about the whole pregnancy sedation thing? So it is not recommended to use sedation unless we can help it. You don't want to use sedation in the first trimester because of risk for like birth defects and developmental issues. You don't want to use sedation in the 3rd trimester because in the 3rd trimester, it can actually put you at risk for preterm labor. You also don't really want to be laying on your back for too long. So if you have to use sedation, the 2nd trimester is the best trimester to use it in. So you want to talk to your healthcare provider about like other options, like maybe taking Xanax or Klonopin or other things. But unfortunately, you do need to try to get it taken care of. Now, if it becomes a medical emergency, they're just going to use sedation. I mean, that's what they're going to have to do. But there are medication options that you can look at. How can I conceive twins without meds? There's no way to increase your odds of that except with meds. There's anything you've heard, anything you've read, there's just the only way to have twins, okay, is 1, you release 2 eggs and they both get fertilized, okay? So you can release 7 eggs, and if they don't all get fertilized, that's just not going to happen. Or 2, an egg is fertilized and it spontaneously splits. You definitely can't cause the spontaneous split, and you cannot necessarily increase the egg count, and you cannot guarantee that they will all get fertilized. And even when you do IVF, where we actually take the eggs out, put the sperm in, fertilize them outside, and then put the babies back in, basically, we could put 7 embryos into your uterus, and you might still only have one baby. The other thing I'm going to tell you guys, twins are not all that. Go on to a whole bunch of twin groups, and you're going to figure out very fast, twins are not that fun. So at 3 in the morning, when you have 2 screaming babies and 1 set of hands, that's all you need to all of a sudden realize that twins, they're really cute, but they're a lot of work. So I don't encourage twins for anybody. I had a question on hepatitis B vaccine. Okay. So, so does anyone know if we can forego the hepatitis B shot? Okay, I am not getting into a vaccine debate. I am here simply to give information. So, can you forego the hepatitis B shot? The answer is yes. You are not required, as far as I know, in the United States and probably any other place that I'm familiar with, to get the hepatitis B shot. Why do we give it in the hospital? Hepatitis B requires 3 vaccines. The first one, then it's 2 weeks later, and then I think it's like 4 or 6 months later. They're always changing the guidelines. But the bottom line is it needs a whole bunch of time. And so they want to get it started because it's one of the oldest vaccines. So they feel it's got the best safety data. So they want to just get this started because of how many vaccines your baby would need to get protection and how long it takes. That's it. There's no other reason that we're doing it in the hospital. Okay. If you do not want to get your baby vaccinated in the hospital, you may have to sign a release saying, like a consent, saying you understand the risks. You may find that certain pediatricians won't see your baby. Make sure your pediatrician is going to be okay with that decision, but you can say no, okay? A vaccine is not a life-saving medication. The exception is if you are hepatitis B positive. If you are hepatitis B positive mom, your baby will receive the hepatitis B vaccine and something called HBIG, which is basically hepatitis B immunoglobulin. This is to prevent the baby from contracting hepatitis B. That would be the only exception where the pediatrician would probably feel like that was not a safe decision for your baby. Other than that, you should be fine. And you can have a conversation with your pediatrician. Okay. I had a question on my depression video. So it asked, what about L-theanine? So I have videos out on depression and medications, right? I am in psychiatry, and I firmly believe that it's very important for women to get treated for depression and anxiety, and the evidence supports that. Now, we're all used to, like, there's homeopathic treatments, and then there's standard medication. I regularly, in my practice, recommend the use of vitamins and herbal supplements for the treatment of mood disorders regularly. I love alternative medicine. And so you guys are aware, L-theanine is like amazing, especially for anxiety. You cannot take it if you are pregnant or breastfeeding. Let me just repeat that. You cannot take that or any other herbal supplement that you think you might know about while you're pregnant or while you're breastfeeding. Okay? There are very few that you can take. Why? They are not regulated. Okay? So in the United States and in many other countries, they do not regulate vitamins. What does this mean? I'm going to speak specifically about the United States. The Food and Drug Administration, they do not check the ingredients that are coming in. They do not check the production lines. They do not check the quality. They do not check anything. This is for all vitamins and herbs. So this includes the vitamin D you give your baby. And just so you know, y'all need to give vitamin D to your babies, whether you're breastfeeding or formula feeding. It is extremely important. Please do that. Now, I just scared you by saying, wait, it's not regulated. Okay, so the best vitamins out there are the cheapest vitamins. You walk into Walmart, you find the cheapest brand, that's the one you should go for. Why? Because 5 trillion people are taking that vitamin. If people were dropping dead, you would know about it. If that vitamin was ineffective, you would know about it because 5 trillion people are taking it right now. So the standard vitamins, magnesium, vitamin D, vitamin C, so many people are taking these that they're very safe. When you start getting into the offshoots like L-theanine, already there's just much less information out there about whether these things even work for what they say they're working for. And an example I'll give you is ashwagandha. That's like the latest popular trend. Ashwagandha, I looked into it. I did a lot of research on it because I had a whole bunch of patients who want to take it. It's very commonly used for anxiety right now. So the ashwagandha, for most of my patients, doesn't work for anxiety, okay? Ashwagandha has a lot of different benefits. It helps with high blood pressure. It helps with diabetes, right? It also increases testosterone. So, you might read one thing that says diabetes and not realize it increases testosterone. Well, you don't really want a lot of testosterone when you're pregnant or breastfeeding. Therefore, this is a great example in one fell swoop of a vitamin you probably shouldn't be taking. So L-theanine is another one of those. We have no safety data. It's not being regulated. Yes, when you're done being pregnant and postpartum, please, it's wonderful, but not right now. There's just no data to say whether it's safe or not. And even if it was safe, there's nobody looking at the ingredients that's coming into your L-theanine, okay? I'm going to be wrapping up pretty soon here. I did have one question that was super quick. It's, should I use warm water or hot water when I'm making formula? The water should be warm. Hot is really not necessary. Maybe you boil a whole bunch of water at the beginning of the day and put it in a thermos to kind of keep it warm. But basically, when you're mixing your formula, you want to check, put a little bit of milk on your skin. So if it was hot and it's too hot for your skin, you're like that, then no, it's too hot for the baby. So nice and warm is good. It can even be room temperature, just so you know. You don't have to have warm formula. That's a misnomer. The babies that really, the only babies that really have to have warm formula are preterm babies. Okay, so those little tiny micro preemies, they kind of need it because you don't want to cool their body temperature down because the formula is too cold. But other than that, no, they don't need that. That's not necessary. Last question for tonight, okay, is the following. It was on my superfoods video, and I thought this was fantastic. So I just found out I'm pregnant, and I'm waiting for 2 weeks to get my first pregnancy appointment, right? I was taking bone broth, and because it has collagen, and I was told it's very good for me. So is it okay for me to use? My first OB appointment is next week, and I'm going to ask her, but I'm going to do a lot of research. So for those of you guys who don't know what bone broth is, basically you can make your own. It's super easy. You take a whole bunch of bones from animals, usually beef or chicken, right? But you basically take it, stick it in a pot of boiling water. You can add vegetables like carrots and tomatoes and onions and different things, spices, and you basically boil it. And you boil it to get all the good stuff out of the marrow, the insides of the bones, which has a lot of really healthy things for you. And of course, it's boiling, so it's boiling off any types of bacteria or viruses or anything like that you might have to worry about. So you boil it off, you throw away the bones, and what's left is a broth, like a soup. It's just basically soup. And you can use it, and it's got a lot of good benefits like collagen. The short answer is yes, bone broth is safe. What I would tell you is if you want to be really safe, make your own. Don't buy store-bought bone broth because, maybe the quality control isn't that good. It's probably also not nearly as nutritious as you making your own. But yeah, ultimately, bone broth is safe and you can use it during your pregnancy. Absolutely. So I'm going to wrap it up there. My name is Dr. Samantha. Hi, I'm the maternity mentor. Thank you for joining me for another one of the live Q&A sessions. We have those here every Monday at 9 p.m. Eastern Standard Time. For those of you guys who aren't aware, I have now been approved to be part of the YouTube Health platform. This means that I am a vetted, real healthcare provider with real content that you can trust. Please like and subscribe to the channel. Subscribe. Please, please, please. This really helps me out as a content creator. I can't tell you how important it is. Please hit the notification bell so you can get notified of our latest content. And for those of you who stuck around to the end, like tomorrow's video, which is second trimester sex. Okay, so this is the second in a 3-part series where I'm talking about the best sex during all 3 trimesters and what you can do, including what you need to know about risks and the best positions to use while you're having sex so you can enjoy yourself each trimester. Please follow us on Facebook, Instagram, and Twitter. Please share the channel with your friends and family. I want to thank you so much for joining me, for subscribing, for being a part of this. I love my Q&As. We will be back here next Monday. I appreciate all of you. I'm Dr. Samantha, the maternity mentor. Bye for now.